Oh, you're gassy, aren't you? Yeah. You know what? Let's teach these beautiful people out there on YouTube world the I love you massage. Are you ready? Okay. So with an infant, especially this young, we are starting really low. Yeah? I know. There's some gas down there, huh, buddy? Yeah. So I'm starting super low. This is where the descending colon is. It's super gentle pressure. Oh, you'll see a lot of videos. What? Yeah, I got you. There's some videos that we'll see out there, and they're called I love you massage. The difficult part is with some of them, and the way I learned I love you massage is that this is the I, this is the L, and this is the U. I know. You know that that's not the right way, don't you? You knew. So the I is actually over here. We're starting with the descending colon. We always want to start low in case, like, he's got some little tough spots. He's trying to get it out. So we're just going to start with real gentle motions and real tiny. I know. Doc, why don't you come over and help hold the pacifier? Do you mind?
Not at all.
Okay.
A really good
when it comes
massage
out.
Assistant.
Yeah.
And pacifier holder.
Wow, that's a title.
I went to Dartmouth to learn how to do this.
Just let him. There you go.
It's just in case it falls out.
Exactly.
Yeah.
So he's trying to release down here. That's what we got going on. So we're assisting it just with real gentleness. Yeah. I got you.
I know that pacifier is just not producing any milk. It's not
so
sweet.
So we're just gonna keep up
nothing
gently.
to swallow. It's like.
And then the focus is down. So I come up a little bit more, and I go down. Come up a little bit more. Oh, I know, sweetie. I feel that. I need to spend a little more time here. But to go over it kind of quickly is we don't ever want to push a bubble or a bowel movement or something that's causing pressure into another area that might be the case too. So we start here and follow the pathway of the colon. So we're just going to work gently down first. Mm-hmm. And if it's helping, then he won't fuss. If it's too much pressure, he'll fuss a little bit, and we stop. So then once we clear this, then we come up a little bit higher, and now we're working on the L. Now we're just going to come and just keep that focus all the way around.
Okay.
And then same thing, like right now for him, this is going to take time because he's still focused here, so you're not ever going to go past that. When he starts to fuss, as you come up higher, you go back down low, which is what he was doing. So once we've cleared that whole way, then we would come over here and then we would finish with the whole thing. But right now, yeah, I got you. The focus needs to be down here. That's helping him so it doesn't seem so tight.
Yeah.
You look concerned, buddy.
You did Cairo. They literally did exactly what you were saying not to do. Where it was like the I love you would start on the right and go down to the left.
Yeah, and all I can say is every baby's different maybe. Maybe that's why they did it that way. It didn't work for mine. And when people come in and say, oh, don't do the I love you massage. I've done the I love you massage, DeeDee, and it doesn't work. And I'll ask, well, show me how you did it. And then I'll show this. And then they'll say, oh, that worked for my baby. So that's the thing, is just listen to your baby. And right now this is working for him.
You're just kind of just gently pressing.
Just gently kind of working with it. And you can kind of feel, sometimes it's, especially when they're this tiny, you'll feel like a little bubble. It's like, oh, what is that? And then after you massage that bubble out, you'll get that.
Yeah.
He's really working.
Right, and that's why we want to kind of relax and do those relaxing things, because he's got some stuff to come out.
Yeah.
It's very, very firm.
Do you have big bowel movements?
Yes.
Yeah. So, that's, you have a good supply, and so there's a lot moving through the intestines. And if you think about it, in the womb, babies are fed from the umbilical cord. And so their intestinal tract is not doing anything. And then they're born and all of a sudden disconnect from mama's umbilical cord, and here's your milk, right? If you've got a large supply, that natural peristalsis, that just the wave-like motion that's supposed to take it from the mouth all the way through, isn't always working quite right. So things back up, which is why the new parent dance can help. You just walk the floor, right? Take turns. Yep. And then this sort of massage is it can be really helpful for some babies.
Just that gentle movement, but that direction can be soothing. I'm gonna actually, just to sort of help him, I'm gonna do a different position.
Okay.
So, show you a couple other things that can help when he's having that. Hi. Yeah. I know. So I'm still now focused. I'm on the left here. I'm putting just gentle pressure still, but kind of allowing that gravity, that weight. And this is another position that doing the newborn, what'd you call it? New parent dance? New parent dance sort of helps, and changing positions. If you try that other one and that's not working and he starts to fuss, then try this. If this doesn't work, then you try something else. Sometimes that just switching, their whole central nervous system. It's all going on. And sometimes moving from from parasympathetic to sympathetic can be tough. And as much as you can while he's got that tension and that torticollis going on, holding him more sideways like this versus having him on you so his head's forced to turn one way. If you can get him laying him on you and you can get him to turn his head the other way, that's great, because that's opening that up. But we don't want to strain. We want to encourage and massage and soften that area, but we don't want to strain. So everything that helps the colon a little bit and release is to just pull the legs up a little bit and help provide a little bit of pressure. One thing that I've seen a lot of, and again, every baby is different, but I'll see people do the bicycle back and forth. We don't want to do that. I would not suggest. You can do whatever you want, people, but I wouldn't suggest, again, not a doctor, just here with some information about what's worked for me and babies I've worked on. You want to work with both, because if you're going back and forth, then you're actually pulling on another area that could have a lot of pressure while you're pushing on another. So now you're pushing up and you're pulling here, you could be backing it back up. Is my thought. I don't know. I'm just a massage therapist.
Everybody on the mommy group said, they're like, it's so simple, bicycle.
Not this young. I think when they get a little older, it's different. But we have to be real careful with the fact that not everything is completely developed, like the digestive system. What do you think, Doc?
So you're going to get so much advice. This is true for breastfeeding, and it's true for a fussy baby. And grandma's always right. So grandmas out there, you're always right. The grandma might have raised 4 or 5 or 10 children, so they have to know, right? But the funny thing is, each kid's different. So try things as long as they're not dangerous. If it works, great. If it doesn't, then you find DeeDee.